The second surprise in the wings was a piece of philosophy that we thought was window dressing in the run-up to the election, and so did the rest of David Cameron's party, and that's the concept of the big society. David Cameron is very committed to a fundamental generational shift away from the big state towards a much more shared societal movement to step up to the plate of mutual support. He wants to alter the balance between state and society. He wants to see not just the voluntary and charitable movement become more involved in mutual support, but also small businesses, a huge increase in the social entrepreneur activity, and communities and individuals to bear more responsibility for their well-being. Now that, again, one could imagine might be a thoroughly excellent thing. Perhaps we have all sat back and expected the state to do stuff for us. But you could also believe that big society means big cuts, and that in a climate where mutual support is the order of the day and public services are rather less in evidence, that the poor, the lonely, the mad, the bad are going to find that they don't get the services that they want. So the other buzzwords that are around in the system at the moment are big society, small state, and efficiency. The interesting thing was that the overall political message of the reforms was that this was not going to be a set of reforms that was about structure and process. This was a set of reforms that was about culture. The debate on health should no longer be about these structural and process issues that had dogged previous reforms, but about priorities and progress in health improvement for all. Well, I think that probably lasted for about 35 seconds because, basically speaking, government has now reverted to doing what government can only do in these circumstances, which is to shift around the structures and the processes. So what have the reactions so far been to these reforms? Well, generally, I think there's been a welcome to some of the key principles, the commitment to outcomes, the commitment to quality, bringing the patient up to the center of the system, an increased emphasis on integration across the parts of the health system and across health and social care, and a focus on public health and prevention. So all good stuff. And I think the primary reactions to the reforms are about how is what is being proposed going to deliver these. First of all, the issue of pace. GP commissioning is already, in some places, beginning to emerge. It's going to be a bottom-up movement, as I said, and it's expected that there will be some pathfinding. We're not allowed to do the word pilots anymore. We don't do pilots. That's too slow. We do pathfinding. And the pathfinders are going to be in place by the end of this financial year. By 2012, all of the commissioning will be restructured around GP commissioning groups, and all GPs will be expected to be part of a commissioning group. And in 2012-13, they will do it with indicative budgets, and in 2013-2014, it will be for real, and they will have real budgets. So the pace is pretty fast. Can we do it in time? The second concern, I think, is about the nature of the GP consortia. Will they work? Are GPs up for it and up to it? There is some track record in the UK of GP practice-based commissioning, but it was very limited in scope, and the more latter versions of it had virtual and not real money, which leads on to one of the issues that has arisen literally in the last few weeks, which makes me think that perhaps the confidence of David Cameron and Andrew Langsley having got it all buttoned down had meant that it was off the radar, because the Treasury has suddenly woken up to the fact that the reforms are proposing that £70 billion worth of public expenditure, 2/3 of the entire NHS budget, will be handed over to GP consortia. A brave move, Minister, I think the phrase is. There are questions about support for commissioning. GPs clearly aren't going to do it all themselves. There will need to be a whole range of skills in epidemiology, in contracting, in risk management, in pricing, in delivery that will be needed to cluster around the GP consortia. Is this just a cunning ruse on behalf of the Conservative government to privatise the whole function of commissioning support? The big American consultancies, anyone here from a big American consultancy? Big American consultancies are slavering on the sidelines at this very moment. I'm personally trying to start a movement for the PCTs themselves to become social enterprises and take the thing away from the government. I think that would be a very good move, but the problem with the PCTs is they've been so kicked around the block over the last few years that they haven't got much energy left to be socially entrepreneurial with. And what will be the scale and the clout of the GP consortia? Are they going to be big enough to do a proper job on population-based health improvement? Will they be able to have, are they going to be big enough to have the right range of skills in order to deliver that task? And most importantly, will they be big enough and skilled enough to be a match for the power of the big providers? Because our tradition in the last 20 years of the purchaser-provider split is that in spite of all efforts, the balance of power still remains with the big providers. That's where the big beasts are, that's where the big money is, that's where the big inertia is, and it will be great if GP consortia can shift that, but nobody's done it so far. What about the issue of the patient as this perfectly informed shopper madly shopping for services with his or her trusty GP at her side? Well, yeah, I mean, we all espouse the patient at the center of the equation and no decision without the patient. But we do need to make sure that we put in place proper mechanisms to give support to the old, the sick, the poor, the demented, so that they're not disenfranchised from this well-informed shopping, so that they equally can make those choices. Any willing provider is another element that has caused some anxiety. Do we really believe in diverse markets? This system will only work if there is a degree of innovation grows up in the provision of services and the offering made to the GP commissioning consortia. But there is a concern, again, that this may be driven by pure politics, that this is simply a way of privatizing the provider market and having the NHS transformed into not a delivery system as it is now, but simply a set of principles against which healthcare is delivered. And the cost of transition are going to be substantial, not just the financial cost at a time when huge cuts are happening, but also a diversion of managerial attention away from meeting some of these big efficiency savings that we're going to have to achieve if we're going to meet the pressures on healthcare for the future. Because these 20 billion efficiency savings and the 45% management costs are all to be achieved by 2014. There may be loss of expertise in the transition. What's going to happen if everybody who's good in the strategic health authorities and the primary care trusts decide to vote with their feet and go and get a job in some other function? And last but not least, I think an issue that as yet has not been articulated well enough to government or by government, and that's the issue of the postcode lottery. We're talking about localism. We're talking about having situations resolved by local decisions and not national diktat. And the inevitable corollary of that is that there will be an unevenness of service across the piece. Now, that's already the case in social care substantially in the UK, but over the last 20 years, there has been an equalising of the standards across healthcare. I believe that that will begin to break down and that we will see diversity. Now, if that's done well with local people so that they're content about the priority decisions that are being made in their behalf, great. But we may well then end up, as we did when the NHS was first created, with such wide disparity of standards that the political cry goes up that something must be done. That if you're living in one borough receiving one standard of care and living cheek by jowl in the next receiving a completely different package, that isn't politically acceptable. So it's going to be interesting to see how brave the coalition government is when the postcode lottery starts to become a reality. There is, of course, an alternative view that the coalition have got this completely wrong and that there was no need to have wholesale reform, that we were already well on the way to resolving or at least making better some of the issues in the NHS, and that the NHS had, as a result of increased investment, previous reform processes and the setting of national top-down targets, improved considerably many of the things that traditionally had been poor in the National Health Service. And that the real way forward would be to take those pre-existing directions that we're going in and simply build on the existing structures and arrangements to bring about further change. So, for example, rather than disbanding the primary care trust commissioning arrangements, simply make sure that there was an overlay of increased GP leadership and involvement and engagement with those, rather than throwing the baby out with the bathwater. And so over the summer, there was a kind of hush in Britain about the reforms, partly because they were announced just before everybody went on holiday and Parliament went into recess, but partly because I think we were all trying to get our heads around them. And it was interesting that after a summer of contemplation, the British Medical Association broke cover. And whereas in the run-up to the election, they had been saying that they supported what the Conservatives were saying, they then began to express extreme anxieties. The generality of GPs were very ambiguous about this new role that was being thrust upon them. And of course, that perennial in the general practice and British Medical Association and government relationship, will you pay us to do this, became quite an interesting phenomenon.